Hello, this is Dr. Hussain. I'm the medical director of a JK medical clinic here on Alton Gloor in Bronzeville. I'm sure that everybody is hearing about this virus, coronavirus, and the issues related to that, and how it is spread, and what is symptomatology, and what should be the treatment of this disease. Luckily, so far, we've been very lucky in the Rio Grande Valley. As of yesterday, from Bronzeville, Cameron County, and Hidalgo County, we have 3 confirmed cases, and all of them are travel related, which is a good news as such. We don't have any local incidents at this time, so which is excellent. The good news is that also that disease is not going to be here forever. That, as I read yesterday, that the China actually has closed all his hospital that he built for the coronavirus disease. The last hospital patient was discharged yesterday. One of the best thing to prevent this disease communicating or spreading to the people is I call this a surface contact. So surface contact means whenever you touch something and some surfaces, so the frequent hand washing or a sanitizer use is going to be the best thing. When you are washing your hands, make sure you wash it thoroughly for about 20 seconds. Anybody that is coughing, I'll try to avoid, because you don't know what kind of carrier he has. Or anybody that is saying that I have been to those areas like California, Washington, or international travel, especially in Italy or France or China, I will be very reluctant to be close to him. He needs to be quarantined at least for 2 weeks. When you develop some cough congestions, it doesn't necessarily mean that you have a coronavirus unless you have been with those high-risk population. I will not consider it. The fact is that right now there is a weather change, spring is coming, so there is a lot of allergies going on, and a lot of people are, have allergies or have a sore throat, running nose. So not necessarily that everybody that has a running nose or sore throat will have a coronavirus disease. Most of the time, I will not even go to the hospital or to the clinic unless I have a very high-grade fever, or I have a dry cough, or I have a difficulty breathing. When you have a difficulty breathing, definitely then the best thing is to go to the emergency room to be checked out, because typical symptoms in advanced coronavirus disease are usually then they have a high-grade fever and very dry cough. It doesn't have any phlegm, but they are also become short of breath when they walk few steps or something. Then they become short of breath. Keep in mind, this disease is not lethal in a younger age group, especially if you are up to 10 years of age. You cannot really have any consequences other than just regular cold symptoms. The problem is those kids that have a coronavirus, for example, that although they themselves will be not a problem, but they can spread this disease. And I think that rightly the school district decided that they have to close the schools, because you don't want it to be one of those spreaders. Although we're not concerned too much about the kids itself, but it's about the community at large. So there is also a lot of rumors I'm hearing about the treatments, and if you do this, you will not get it. Or although there are some experimental medicines that are being used, but I don't think so that you guys need to worry too much about it. There is no specific treatment at this time. There are a few medicines that are being used on those people that has been affected, but their efficacy or their success is not being evaluated properly. There are some medicine that FDA is going under trial. Also, whenever somebody has a suspicion for a coronavirus, there is a public health department's numbers, and I have personal experience with them. They are excellent. They will give you a very good advice what to do in any case when you have a suspicion or symptoms related to this. So I will definitely call them before even I call my doctor. The other thing is that please don't get too much fear about this. It is the mortality of this thing or is very, very low, especially in a younger population. The only people that are going to be concerned about is your grandparents, which are about 65 plus or 70s, or the people who have a blood pressure problem or a lung disease or a diabetes. Those are the people that concern. I know that at this time there are the kids and the families, they are off from work and they want to go and meet with their loved ones. If any of the member of family is coughing or having anything, I will rather stay away from the family member, especially the old folks. That will be very, very appropriate at this time.